second day of International AIDS Conference. And dear friends, colleagues, and all participants of International AIDS Conference, today's first sessions on VCT at that work model, reaching the unreached, rethinking and strengthening awareness, outreach and service delivery for informal and unorganized sector workers. Subject on VCT and workplace model, how to increase VCT awareness program. So may I request to Mr. Syed Mohammad Afsar, ILO Geneva. So please, Mr. Syed Mohammad Afsar. Thank you, sir.
Hello, everyone. So I'm very happy to join you in this session and speak on reaching the unreached. And when we talk about reaching the unreached, I'm going to share today the experience of ILO's approach, in which we developed a program on voluntary counseling and testing of workers. In short, VCT at work. So I will talk about why we did it, how we did it, what tools we developed, and what are the lessons that we learned. So basically, the idea is to answer three questions. First, who are not being reached? Second, why are they not being reached? And third, how can we reach them? So as we developed this program called Voluntary Counseling and Testing of Workers, VCT at Work, actually, we developed it in 2013 along with UNAIDS and a couple of other partners, International Organization of Employers or International Congress of Trade Unions, and a number of other partners, including civil society organizations, global network of people living with HIV. So we basically had these three questions in mind when we developed this program. So first of all, and this situation is still very clear, that actually in general, men are not being reached in the AIDS response, because when we compare men against the global 95, 95, 95 targets, they are lagging behind in comparison to women. So globally, women 92% know their HIV status, but only 84% men know that they have HIV. Secondly, those who are on who know their status, are they accessing treatment? 83% of women who know their HIV status are on treatment, whereas only 73% of men are. And third, 95 is those who are on treatment and have achieved viral suppression as a result of effective treatment. 79% women are there, but only 69% men. So when we see this, and this is coming from UNAIDS 2025 report, men are actually lagging behind in all the three targets. First, knowing their status. Secondly, being on treatment. And third, effectiveness of treatment in terms of suppressing the viral load. So keeping these this scenario in mind, the idea was to reach out primarily to men, because they were being left behind, and they're still. But it's a very big group. So who are the men who are not being reached? Men who are in the informal economy, men who are mobile, men who are migrant workers. And since workplaces bring large amount of them, people together, the program was to offer HIV testing in the workplaces. So the first approach that this program adopted was a rights-based approach, because the question was, why don't people test? Is because stigma and discrimination. They feel their jobs will be lost if employers come to know that they have HIV. So these are the things which are stopping workers to take the HIV test. Then again, convenience of workers to go to a health facility and take the test, particularly for an informal economy worker, was another big constraint. So we adopted a rights-based approach, which means assuring workers that they will not lose their job, their rights will be protected. through HIV workplace policies, which were developed in line with the ILO's recommendation 2. So that was the first pillar. Second pillar was developing strategic partnerships between world of work actors and national AIDS programs, between Ministry of Labor and Ministries of Health, between private sector, involving trade unions, employers organizations, networks of people living with HIV and AIDS, and also civil society organizations who have the expertise to work on HIV and AIDS. Those strategic partnerships played a huge role in the initiative. The third pillar was advocacy and communication, because to create demand and tell people, enhance their risk perception that they need to take the test even when they are physically fit and healthy, because HIV goes unnoticed for years and there are no immediate symptoms and exclusive symptoms. So this was another reason why people were not coming to take the test. So telling them that HIV goes unnoticed for years, it comes without any specific symptoms in the beginning, and therefore taking an early test when you are still healthy and fit is a good idea. Then you can, if that is the case, you can start the treatment. So advocacy played a very important role to enhance risk perception and create demand. Then the next pillar was linking people to care and treatment. Those who were found HIV, the idea was to immediately connect them to receive antiretroviral treatment, and not just antiretroviral treatment. We also enhance access to social protection and other care mechanisms that they were needed. Monitoring and evaluation was another feature. Like in any program, you got to monitor how many are you reaching, how many of them were put on treatment, etc. So, and what is a breakup, gender breakup of people you reached. So monitoring was an important aspect of the program. As we implemented, HIV self-testing became available, and we developed a policy brief along with WHO to do HIV testing at the workplace, where guidelines were developed, and HIV testing became an important tool, which was very well received by workers. And the last pillar was adopting an integrated testing approach, the overarching health and wellness approach at work, because employers were very keen on a broader framework of health and wellness within which they wanted to do HIV work. So we did HIV testing, but not HIV testing alone, along with testing for blood sugar levels, hypertension, and tuberculosis, and other conditions. It required much more coordination with different service providers, but it reduced stigma related to HIV testing alone. And it also was useful for workers to access a health camp or an event and get to know their health status much in advance. So these were the pillars of VCT program. The approach was we prioritized workplaces which already had a workplace policy and program, because we wanted to build on the work awareness work which had already been done, the policy which was promising non-discrimination, the policy which was protecting, assuring workers that their confidentiality will be respected. And those elements were restated and clearly reiterated in the approach of VCT to keep a focus on human rights. We also felt adopting a sectoral approach to which men at risk would work. So we worked in construction sector because they engage a lot of mobile and migrant workers. We worked with transport sectors, in mining, and in different sectors. In some countries, people also adopted agriculture sector, tea plantations, where they implemented programs, because these programs were also aligned. And as we implemented, we realized that it allowed us to reach clients of sex workers, because they were also coming from Mumbai, and migrant workers, sometimes youth as well. And the beauty of this approach was that we could leverage existing workplace resources, which means the people. So we trained peer educators in every workplace where we implemented this program. They were given tools to educate their co-workers. We used structures which exist in some workplaces, like workplace clinics, occupational safety and health programs, wellness programs that exist in workplaces. So we built on those existing infrastructures and programs, and that actually ensured The programs were much more sustainable, capacities were built, and there were also resources available, so much more um, technically sound and financially sustainable. Partnerships I spoke about played a very important role. And ILO's role essentially was to bring all the partners together, use the ILO's convening partner role, and then provide technical support in terms of policies and programs and training of peer educators, linking them up with different service providers. Last year, on 1st of December, we have produced a global report, which the link of this report is inbuilt into these pictures as I speak. One could see this program captures the results, good practices coming from different countries, which is very interesting to read and the lessons. In short, the conclusion of this report is that workplace-based rights-driven approaches can significantly expand access to HIV testing and services while reducing stigma and discrimination. And we also showed that this program reached populations were often left behind, such as men, informal economy workers, refugees, kinds of sex workers. And we reached them not only with HIV testing, but we also linked them to social protection and other important care and support mechanisms. We developed two tools. On the left of your screen, you will see there's an online training program that we have developed through our International Training Center in Turin, Italy. This is a free course. Anyone can do it who wants to do workplace programs and HIV testing. It's called HIV testing at the workplace, but it also has modules on addressing stigma and discrimination, training of peer educators, monitoring and evaluation, workplace policies. So it comes with 9 modules, and people can do it in about 6 to 8 hours, depending upon how fast they do it. We also developed a toolkit, the second picture that you see on the screen, which is for training peer educators on HIV workplace programs and voluntary counseling and testing. This lays down an agenda for the training program, different sessions, session objectives, methodology that people would adopt, and lots of training tools, including some presentations, which can be updated, adapted to suit local contexts and used by the workplaces. So I strongly recommend people to make use of these two tools that we have developed. Uh, so what did we achieve? Just to present the last 3 years picture between 21 and 2024, we were able to reach out to about close to 2.4 million people. About 1.8 of them were men, which means it showed that by targeting industries which are highly engaged men in a large number, and then one could reach out to men who are not coming to health facilities so often. 1.4 million workers came to know their status as a result of this initiative in the last 3 years under mention, and 1.1 of them were men. So this shows that majority of men were being reached. About 48,000 workers were tested positive, 37,000 of them were men. So this also shows about 3.38 HIV positivity rate amongst men through workplaces, which is okay. Because these are the men who are not coming to workplace to the testing facilities anymore. And then close to 100%, about 97% of them were linked to access HIV treatment. So this shows that HIV testing at workplaces, if done properly, linked to treatment, is effective. It allows us to reach men, it allows us to reach men who are at the risk, particularly those men who don't visit health facilities. We also did a qualitative study in Nigeria on the efficacy of HIV self-testing, and we found that respondents, most of the workers mentioned that there are several advantages of HIV self-testing. First, it's simple, it's convenient, it's non-invasive, it's less stigmatizing, saves and cost, particularly the opportunity cost for workers to go to a facility for initial screening. But this study also showed that HIV testing works, self-testing works, but it needs to be accompanied by awareness sessions at the workplaces, and peer educators played a very important role in creating demand and knowledge. And they were the ones who were actually distributing self-test kits. So workers knew whom to contact in case they had more information. And then how to use the self-test kit was demonstrated in training programs, and peer educators also lent their support to them. And we also realized that workers are now saying if the test case costs are further reduced, it will greatly enhance the uptake. Now, these are the numbers. We also partnered with the UnitAid and a number of other NGOs who are working with the UnitAid project in 7 countries, mostly in Africa, but also India and Indonesia. And here also the same results. We found men were reached in big numbers. And most important thing is that a great number of them, about 16% of them, were first-time testers. So HIV testing at work, including HIV self-testing, allows us to reach first-time testers as well as those who don't test too often. So it's a very important strategy. And on the picture that you say, this is the policy brief we talked about. I wrote developed with WHO on how to do HIV self-testing at the workplace, and then another document we produced on HIV self-testing, what are the approaches to implementation and sustainable financing. This document also comes up with good practices and also the uh, examples from different countries, including Africa and Indonesia. One element that we implemented, as I said, to enhance access to social protection through VCT, because as we were doing program in several countries, including India and Uganda, Kenya, we started enrolling people, particularly the informal economy workers, migrant workers, into the government social protection schemes and health insurance schemes. And we realized that workers were not aware of those schemes, and they were not sure how to access those schemes. So the idea was to map the schemes in a country, and then make workers aware of them, and facilitate workers' registration into those schemes. So this our partner in Gujarat, GAP, implemented a hugely successful program for a number of years, reaching out to migrant workers and then registering them into social protection schemes of the government. There are lots of schemes of the Labor Welfare Department, including so they make an e-Nirman card or the e-construction card. And this worker said that I had lost hopes when I was detected positive for HIV, but due to counseling and treatment, I am working again. So on one hand, the person received ART and started working well again. And secondly, he also got to know about this e-Nirman card of the government Labor Department's scheme. And through this, he could get a land to construct his house. So all this happened because I got correct information at the right time. So over 100,000 migrant and industrial workers were reached by GAP, and majority of them were men. This good practice is documented, and the link is there in the screen. We have also demonstrated that VCT at work, actually when implemented with migrant and mobile workers as well as youth, allows us to reach kinds of sex workers. So we actually prioritized some of the workplaces which were close to sex work sites. In Kenya, we worked with truck drivers as well as sex workers. And this sex workers said that truck drivers are our primary client. Following the joint awareness sessions for truckers and female sex workers, it has become easier for us to negotiate safe sex with truck drivers. So these kind of experiences are coming up, hugely important, and the same things as acknowledgement by the Ministry of Health colleagues that self-testing is a great way to reach mobile and migrant workers as well as kinds of sex workers whom we could not effectively reach earlier, as you see in this message. Truck drivers themselves have welcomed this initiative because this truck driver from Kenya says getting information on how to use self-test kits and getting the self-test kits at the truck stops is a great idea. I don't need to worry about parking my truck when I go for a health test in a health facility, and I can test at my own convenience. Having talked about the approach, now just talk about 5 lessons to close my intervention. So first lesson here is that engaging workplace leader has helped. We have done CEO testing, we have done testing of trade union leaders, we have done testing of senior people in the workplaces. So to show that it's not only for worker level people only, it's not just for floor shop workers. And then assurance by management that workers will not lose their job if they test positive. For example, this message coming from the HR manager in Sri Lanka. I have taken the test myself, and I encourage my employees to do the same. Those who test positive should not worry. Their jobs will be protected and they'll be taken care of. These kind of testing events involving CEOs and capturing these messages, putting them on the walls, in the intranet of companies helped a lot. It created a conducive environment for everyone to come forward and take the test. Second lesson is we communicated the benefits of testing early, which means allows us to stay healthy, it allows us to stay fit, it allows it's easy, it's convenient. So we kept, as we implemented the program, we kept on capturing the messages coming from the users, the workers, as well as leaders who were talking about benefits of HIV testing. And we developed a social media campaign, as you see some of these messages and flashing, to talk about. And these are cost-effective campaigns which can be done in any situation. Ignorance is not good. I took the HIV test, don't be scared. These kind of messages helped on communicating the benefits of testing. We also learned the third lesson is that VCT at work has triggered public-private partnerships, and it has allowed us to use additional resources, leverage additional resources. We have worked with business coalitions in Mozambique. We have worked with employers organizations, enterprises in almost every country. And this is an extremely useful strategy to strengthen public-private partnerships for HIV response. As we were implementing, we were constantly capturing positive stories of this impact the VCT at work was making on workers. So wherever workers were comfortable, they were giving consent. So we were capturing their case studies and we're putting them into short videos or sometimes just writing about them on a website or on a poster. So people were talking about, for this lady had lost her job, but in her company, when this VCT program started happening, they realized that the VCT HIV with HIV people can work, and HIV does not spread by day-to-day workplace contact. So they called her back, they gave her job back. And these kind of positive stories were collected and disseminated. So finally, the lesson is workplaces can close gaps in HIV testing for men, as well as reach out to those who are not being reached effectively, for a number of reasons, which I've talked about. So as we are talking about in this conference, as we are rethinking, rebuilding, and rising, so we need to rethink about our HIV testing approaches, and VCT is a good model to be kept in mind. What can be done at workplace? Potential of workplaces are not being fully utilized, and that needs to be done. We can rebuild and rise to the occasion, and I hope um, participants will find these few tips and lessons useful and make use of these tools that are presented. Thank you very much.
Thank you very much, sir. Uh, Syed Mohammad Afsar, very interesting. VCT at the workplace, and Mr. Syed showing that how to improve VCT and how how become a helping together. Thank you very much, sir. Now, may I request to Mr. Jogendra Upadhyay, Project Director, Targeting the Intervention Program and Link Worker Scheme, Gujarat AIDS Surveillance Prevention Unit, GAP ISRCDE, Gujarat, India. Talking about expanding covering of expensive intervention and testing strategy. Mr. Jogendra Upadhyay, please welcome, sir. Thank you, sir.
Good morning, delegates, activists, scientists, and community leaders. Myself, Jogendra Upadhyay, Project Director, Gujarat AIDS Awareness and Prevention Unit from Gujarat, India. The Global Village 160 Networking Zone booth will welcome all of you delegates. My session is the expanding coverage of comprehensive intervention and testing strategy. Needs. According to International Labour Organization, ILO, about 60% workers in emerging and developing employed in the unorganized or informal sector. To healthcare society, protection and labor rights are limited. Evidence from GAP NGO, India, highlighting critical gap in the HIV prevention, testing and care support of migrant, mobile and unorganized sector workers. Limited coverage under AIDS control program and insufficient resources have left this community highly vulnerable to HIV and other STI, worsened by stigma and structural barrier to care. The project idea. This project idea is combined three NGO joint partnership with the three organized. One is the ILO, second is the GAP implementation agent, and third is the technical support from Gujarat State AIDS Control Society, government of Gujarat. Our project idea is reach out reach out to bring population unorganized sector labor in the 5 district and partial part of the three district of Gujarat state. Gujarat have 33 districts and we focus on the 8 districts in the state. Contribute to HIV test and treat objective GSEX and our National AIDS Control Organization policy. Develop a model based on multi-sectorial engagement involving in the industry association and unions to lead social protection scheme. Our adopted model of VCT at the workplace regarding to HIV testing gap in a migrant, mobile and unorganized informal sector labor. GAP NGO India, supported by ILO, the VCT at the work initiative in the bringing confidential right-based HIV testing, counseling, direct workplace through strong policies, peer lead approaches, and commitment and the initiative successful expand access to HIV testing and treatment services. This is our strategic pillar. Strategic pillar is a right-based approach. Strategic partnership with the industry association at the state level, district level, and private sectors, construction labor, construction builders, and market association, government ICTC and ART centers, TV department, advocacy and communication, integrated health testing, community-based workplace HIV testing, linkage to care and treatment, and monitoring and evaluation. This is our pillars of the VCT at the work. Strong partnership is a key role. Federation of Industrial Association of Gujarat State, Industry Development Corporation of Gujarat State, Small Scale Industries Association, LBU, Laghu Udyog Bharati is from very big Industrial Association of India, Cold Storage Association, Sawmills Associations, Construction Site, CREDI is a builder association, Metro Construction, Market Agriculture Product, Vegetable Product, engage the 983 key stakeholders in this project. Mapping is a very essential and initiative. Our workers, our outreach workers, go to the field and individual meet with the owner, HR manager, supervisor, and mapping industries, construction site, and all the sites of industries and construction market and all the units. This practice can useful to our planning. Strategic communication outreach through the targeted BCC campaign, one-to-one contact, one-to-group contact, use the media, mass awareness program, use the snake and ladder IEC material, use the film, and use the flip chart book. We reach during the 2020 to 2025, we reached 2,920 workplace and 1,90,445 workers promoting STI, HIV awareness, including TB, including hepatitis B and C, increasing HIV testing uptake. Community-based screening at workplaces. This is our key program. Workplace HIV screening improve the access to HIV testing among workers who have never been tested. And all the industries support for this program. And they gave the specific space for counseling, specific place for testing. All the environment is good environment and discrimination-free environment. Therefore, we total of 4,873 workers were screened for the HIV through 119 community-based HIV screening camp. The positivity among workers was 0.30. In India, our national figure is 0.21. Is higher than of our new detection positivity rate. And one good thing is they are never testing in he or her life. Linkage care and treatment to new HIV detection. Workers newly diagnosed with HIV, post-test counseling and linked to nearest antiretroviral therapy for the treatment and care index testing services, and also offer their spouse, partners and children to facilitate early HIV diagnosis and timely linkage to prevention, care and treatment services. And in this our journey, in our journey, so many migrants from outstate, from Bihar, Uttar Pradesh, we communicate with local ICTC and local ART center for the index testing, and we got a successful result for the index testing. The strategic capacity of the workers living with HIV. The important is the worker capacity building who living with HIV, because if lack of knowledge about the adherence and other skills or program is failing. Therefore, we develop and conduct the workers living with HIV capacity building program. This is the participator use the participatory methodology 1-day workshop. Good, we give the information, we give the skills, how to keep the ART treatment adherence, all the life skill education, and we introduce the index testing and psychological support, and we gave the leadership of the worker, people living with HIV. Social protection is an important key because in India there are a lot of social schemes with the unorganized informal sector and migrant labor workers. One is the labor card, insurance card, and Ayushman Bharat is a health, give the free of health facility from central government of Gujarat, India, and we linkage with the community services with the for issues of this social protection card. The key achievement, what we got. First, 80% male are tested from this targeted group. We reduce the male HIV testing gap. Second, first timer HIV tested. 99.66 are first timer HIV tested. Because our program is not reached is the last bench to our migrant, our mobile people, our unorganized sector workers. 73% of workers are age group is 18 to 35. This is our productivity group. 99.86% confirmative test. If the first test is then the community-based HIV screening, after confirmative test from ICTC, but no various. This is our success rate. 96.57% are newly diagnosed HIV positive workers were asymptomatic. This is the big achievement of this project. And still today, the 98, more than 98% viral load is suppressed and got TNB targets. This is our second ever we got achievement. What is lesson? This assessment revealed this migrant workers face stigma burden of STI, HIV risk, vulnerability as a worker in the local informal and unorganized workforce, highlighting the need for inclusive prevention testing services across both populations. My conclusion, the VCT at the Workplace Initiative demonstrate the workplace-based HIV screening, right drive approach can effectively expand the access to HIV testing and services, reduce the stigma and discrimination, and strengthening linkage to treatment and social protection, particularly among unserved population. Call to action in 2026 Brazil conference. There is an urgent need to prioritize and often unserved workforce, informal and unorganized sector, whose inclusion is essential to achieving the global 95 HIV targets. Despite their significant contribution to economic growth and social development, these workers frequently face barriers to equitable access to HIV prevention, testing, treatment, and care services to Global South. Thank you very much.
Thank you, Jogendra. Very interesting VCT project for 7 districts of Gujarat, India. Very nice. So our session is how to reach unorganized sector, particularly unorganized sectors, labors, and district migration. So I hope you have a lot of learn, and this session is finished for today, and next session is 12:30. So please come to 12:30 on very interesting session. Thank you very much. Thank you.